Dr. Morley. I'm Kathy from Dr. Balsama's office, and I'm coming here today to ask you a few questions about our patients that are preparing for bariatric surgery and why it's so important to have a pulmonary clearance and a sleep study. So my first question to you is, what is sleep apnea?
The most common form of sleep apnea that we have to deal with within the bariatric population is obstructive sleep apnea. It's basically an obstruction of the upper airway that occurs during the night while the person's sleeping. When it happens, the muscles in the back of your throat relax and they make the upper airway more narrow. And what happens at first, people start to snore, and then if it tightens anymore, they actually block their airway. And it happens many, many times per night. And when it happens, it makes your oxygen go low, it makes the patient's heart rate go up and down, and makes their blood pressure fluctuate. So in the long run, it causes a lot of physiologic damage for the patient in terms of makes them excessively sleepy during the day and poor daytime function, basically.
Huh. Okay. And how is it diagnosed? What are the symptoms you already told me, but how do you diagnose it?
Most of the times the symptoms, as I said, are snoring, and oftentimes the patient's family will notice that they'll wake, the patient will stop breathing at night. They want to poke them and tell them to start breathing again. Sometimes the patient themselves will wake up gasping for air and things like that. And the way we make the diagnosis is basically most of the time we do what's called a sleep study, where we send the patient to the lab and do a variety of testing on them to see how bad their sleep apnea is. Essentially what they do is they put a series of EEG on the patient to see if they're sleeping, whether they're sleeping or not. They'll also put a variety of gauges on to check if they snore, to check their oxygen in their blood, those sorts of things. But the most important thing they do is they count up how many times an hour the person has an apnea. Every time a person has an apnea, kind of fragments their sleep, it makes them feel like they don't get enough sleep. The more apneas that they have at night, generally the more tired they're going to be during the day. And it happens very gradually over a very long period of time, pretty much like high blood pressure. They have to have it a long time before they start to have the more severe symptoms.
Okay. And how do you determine whether you're going to have a sleep study in lab or at home?
The best study, the gold standard for making a diagnosis of sleep apnea is to do an in-lab study. When they do the in-lab study, most importantly, they can find out if the person's sleeping or not. When you have a home study, you're really not, you can't prove that person's sleeping or not sleeping. So that's a major limitation of the home sleep study. But having said that, for people that have no other comorbidities, they're not diabetic, they don't have hypertension, there's a pretty good correlation between the home sleep study and the in-lab sleep study. I would just make the point that in people that have severe symptoms, almost always their home sleep study is going to be positive. In people that have less severe symptoms, sometimes it's not positive. You still have to send them for an in-lab study.
Okay. Huh. And then, well, you've already told us what happens in the sleep center. A couple of the patients are asking me lately about or telling me that they're not able to sleep there.
Yes.
Is that one of the?
Yes, it's very. When you go to the sleep lab, and when people are at home, they probably sleep about 90–95% of the night. People, when they go to the sleep lab, the first night that they're there, they may only sleep 60% or maybe 70% of the night, sometimes less than that. So that it's called the first night sleep effect when they go to the lab, and it happens all the time. Even having said that, even if people only sleep 4 or 5 hours in the lab, we can generally tell if they have significant sleep apnea. So that, matter of fact, you need at least 2 hours, but obviously the more they sleep in lab, the better the sleep study will get.
Good, good. And at what point does a patient come to see you?
Well, in two ways. Often the bariatric surgeon will send them. There's such a high incidence of people that have bariatric surgery. Somewhere between 40–70% of people that have bariatric surgery also have sleep apnea, so they often go together. Sometimes their symptoms, either their family doctor or the bariatric surgeon will send them directly to the sleep lab to have a sleep study performed or a home study performed. And then we'll get the patient and the report back. Sometimes the surgeons will prefer that we see them first, we send them for the sleep lab, and then we make the diagnosis that way.
Perfect. Okay, well, you answered all of my questions, and I thank you so much for seeing our patients, and that'll be it.
Very good.
Thank you.
Thank you for having me.